shut the door for some privacy. Can you tell me your name and date of birth, please?
Irina Track. I'm 23 years old.
Perfect. I'm going to pretend some hand hygiene here. So I'm looking at your orders here, and it looks like your doctor has prescribed you some Zofran. Do you have any allergies?
No, I do not.
Perfect. Okay. So your the medication that you're being prescribed is Zofran, which we're going to push 4 milligrams, which is 2 milliliters. I'm looking at this medication now. It is not expired. We're giving this to you because it reduces nausea and vomiting, which is going to help with the medication that you also have ordered, which is cephaloxone, which can cause nausea and vomiting. So this is going to help with that. We'll get to this in a second. I have on here, it's the right time, the right patient, the right reason. Do you want to get this medication?
Yes.
Perfect. All right. And then I will make sure I document it. Okay. Let me just check your IV site because this is going through your IV. So I'm looking at the IV here. Are you feeling any pain?
No pain.
Perfect. I don't see any redness or any bruising. So we're going to go ahead and proceed. I'm going to put some gloves on. Okay. So now I'm going to scan your wristband. Beep. Beep. And scan the medication. So we have that right here. Again, for pretend purposes, I do have gloves on during this procedure. All right, I'm going to clean this bottle for at least 30 seconds. And normally I have more workspace. All right, I'm going to pull up 2 milliliters of air. Push in and pull. All right, I'm going to set that there. I'm going to flush your IV site. And I'm also going to clean your IV hub. I'm going to do that for about 10 seconds. I'm going to make sure that your IV hub does not touch anything. I'm just going to do a few milliliters of flush. Perfect. All right. This would go into a sharps container. And the IV medication, Zofran, would be pushed over 2 minutes, but for the sake of time, we're just going to say that this process will take 2 minutes. And then we'll go ahead and flush again. And again, we're just going to do a few milliliters. Perfect. Are you feeling any pain?
No, I'm not.
Perfect. All right. So with this medication, and I'm just going to go ahead and cap it so it's clean. This medication can cause headache or dizziness, so just be aware of that and let us know if you feel any changes. Okay. Perfect. So that's capped. It's clean. So now I'm going to move on to your other medications here. We are going to hang a sodium chloride. All right. And this is going to be 42 drops a minute, which is gravity, and we're going to hang it. So I'm going to scan your ID. Boop, boop. All right, the thing to just be aware of this can give a salty taste in your mouth. So I just want you to be aware of that, okay? And we're gonna hang, we have some tubing. This is just gonna be your primary. All right, and again, I just wanna say I have gloves on during this whole procedure. Okay. So I have my spike. I'm just gonna look here and make sure that I am clamped. All right. And just gonna squeeze into this tube about halfway. And now I'm going to prime. So I'm gonna slowly roll here, unclamp. And I'm gonna just watch all of it, make sure there's no air bubbles. I'm gonna go ahead and hook you up. You are clean, and I know I just flushed it. So I'm gonna go ahead and cap you in. And then I have the normal saline, so I'm gonna go ahead, and this is going to be at 42 drops a minute. So we're gonna watch, and for the sake of time, I'm just gonna say I do have this going at the correct rate at 42 drops a minute. Perfect. Okay. Are you feeling any pain or any changes?
No, I'm not.
Perfect. Okay, so your other medication is an antibiotic. It's to help with an infection that you do have going on. This medication is not expired, neither was this medication. And so I'm gonna go ahead and scan your name. Beep. All right, so this is a piggyback. So what's gonna happen is I will lower this bag while I hang this one, and then we will, this will finish all the way. This is going to be 2 drops a minute, and this is gonna go over for 8 hours. It's 50 milliliters, okay? All right. Okay, so this is a piggyback, so I am gonna lower this one here. Make sure this is clamped all the way. All right, and I'm going to fill until about middle way through. And I'm going to slowly unclamp. Make sure all the bubbles go through. All right, we're gonna clamp it. Okay. This does not have a cap on it, so I'm gonna make sure I clean it. right, I'm gonna open this one. And then this is going to be 2 drops a minute. So we are going to slowly adjust this main hub here. And for the sake of the video, we're gonna say that it is at 2 drops a minute. Okay. And are you feeling any dizziness, nausea, vomiting?
No.
Okay. You have your call light. I will come back when this is finished. Your bed is lowered. You have all your personal items. Do you need to use the restroom at all?
No, I do not.
Okay. Well, I will make sure that we are back. It might start beeping when it's done, but I will be back before then. If you need anything, you go ahead and hit your call light. And I hope you have a good day, Miss Tract.
You too.